Okay.
Hi, Claudia.
Hi, Liz. Hi, everyone. In this case, we are talking about what's COVID-19 and also the some questions and things that we think that in this moment, in this situation, we are all thinking about, and we recollect some information that will help you to understand some assumptions that you have, or maybe to learn new things, right? So let's begin. What is COVID-19? Well, COVID-19 is an infectious disease that belongs to one family of viruses that can cause disease like in animals and in persons. The principal symptoms are fever, dry cough, and tiredness, but also some patients could have a nasal congestion, sore throat, itches, and diarrhea. There are vulnerable people that they will need to be hospitalized if they have the virus. That are the people who have cardiac problems and respiratory problems. Also, well, in this moment, there's not a vaccine, drug, or treatment that cure this cure this disease, but the researchers and the universities are looking for some drug that can help us to get better soon. In the thing of protection, well, we have to wash our hands frequently and for 20 seconds. We have to avoid to touch our eyes, nose, and mouth with our hands. And we need to keep a distance between another person of 1 meter. Also, some people get confused about isolation and quarantine. Well, isolation is for the people that has already this COVID-19, and they have to stay home and don't go outside for any reason. And self-quarantine, it's the means that a person who stays in his house because he doesn't want to get infected by anyone, because this virus is transmitted by some jobs from your mouth that may still in the ground or in everywhere you go. So there are some people that are avoiding to get out to prevent to contact this virus. In this case, Liz, can you tell us how serious is a pandemic disease?
Yes, of course. Claudia, as you were saying, the symptoms seems really bad. Um, I think this pandemic is really serious, and if the country hadn't taken actions immediately in order to stop the spread of the virus, probably now we could get or the country could get a lot of infected, maybe millions of deaths. Besides, the people have to consider that their lives are in a big risk now, and also the lives of their family,
Mm-hmm.
because it's really easy to get this virus. Um, I think the worst part of this is that you couldn't know if you are infected or no until weeks later. So because the symptoms usually appears 2 weeks later or maybe 3 weeks later.
Mm-hmm.
You don't know if you could infect another people, or even if the people, even the people who live with you. Claudia,
Mhm.
do you know what is who? Do you know what they recommend us?
Yes, WHO is the World Health Organization, and basically, they in Europe make new that tell us some recommendations to do in this quarantine time. That is, for example, to make 150 minutes of exercise or 75 minutes every week. Also, take short active breaks between your work. What are you doing? So you can stretch and relax. Also, you have to walk in your house and stand up and eat healthy because they want to prevent the sedentary behavior. So then, Liz, what can governments do to prevent and slow down transmission?
Well, government could invest more money in our health systems because now they are so crowded and they are close to collapse. And also governments have the responsibility to protect all the population, so they have to analyze the situation around the world, probably do compares with the context to the context in another countries, and give us the right instruction that we could follow so we can contract the virus. And another thing that I could realize in this context, um, is that government are giving money to the people who need more now, but sometimes these people don't know how to invest this money. So maybe the government could uh, help to these people if they do some programs that could educate to these people about what kind of product they could buy or ways to economize.
Mm-hmm.
And but uh, I think that the virologists will find a cure um in some time, because nowadays science is fantastic,
Mm-hmm.
but it could be a really a slow process because virologists need time to evaluate or study the virus behavior, because this virus is or has appeared recently.
Mm-hmm.
And unfortunately, the virus is now growing up extremely quickly, and it's really probably that we have to see more victims until the cure can be founded.
Mm-hmm. Yes, I agree with that.
Yes, Claudia, to end this topic, what are the main challenges that COVID-19 brings our health care system?
Well, in this case, well, Peru, we don't have a healthcare system very structured, but well, in this case, we are facing well, the reality now is that the emergency care beds are at the top right now. Are They're occupied. also the breathing machines. So in one point, this will break out, and we will have more people in the hospitals, but they will be full. So they have to manage that. So there are more space in the hospital and the clinics to put these patients that need to be hospitalized. And also another challenge is to try to instill better hygiene habits in the citizen, in the population, because that is the only way that they could take care of themselves and the others on their family, and this could prevent reboot of the disease. And that's all. Thank you very much, Liz, for answering these questions. Thank you, everyone, to hear us.
Yeah, thank you to everyone. Thank you, Claudia. Goodbye.
Bye. Thank you.
Ya habrá quedado bien.